Hello, and welcome to The Mind of a Therapist, a podcast where I interview psychotherapists and helping professionals and what they're passionate about in order to provide you with messages of encouragement and hope. I'm your host, Andrew Earle. The Mind of a Therapist is sponsored by Psychological Counseling Services, healing hearts and transforming lives. Look into our intensive at pcsearle.com. Hello, listeners. I just wanted to take a moment to say thank you. Thanks for listening to the podcast. Thanks for those who have left ratings and reviews. It's really supportive of the work that we're doing. I wanted to invite you to shoot me an email at themindofatherapist@gmail.com. I'll put a link to that email in the show notes. And I just want to hear from the listeners, any sort of feedback, what you've been enjoying, anything you haven't been enjoying, and we really want this podcast to be a service to you and to be interviewing folks who help you either in your clinical practice or for those who aren't therapists, help you in your lives, in your healing journey. The same for therapists as well. I think we're in a parallel process. So thanks again, and please reach out. Look forward to hearing from you. Bye-bye. In today's interview, I interviewed Tommie. Tommie is an expanded practice dental hygienist with a special permit that allows her to practice outside of the traditional dental office. She has been in dentistry over 18 years. In 2020, she was introduced to Airway Health and has started to connect the dots by discovering the root cause of many illnesses and disorders, especially as it related to her own son. Since then, she's taken over 2 years of myofunctional therapy training and hopes to educate providers in the area for a more collaborative approach to patient care and to empowering patients to advocate for their own health. So without further ado, here's my interview with Tommie. All right, Tommie, thanks for being on the podcast today. I'm excited about this conversation. And in my field of psychotherapy, there's a lot more discussion these days about the importance of sleep, a lot more discussion about like meditation and different breathing exercises, like diaphragmatic breathing, square breathing that we recommend for clients. And I know that your focus is on breath, what can go wrong for people and get in the way, and how that affects both mental and physical health. So super excited to get into this. But before we move in that direction, the first question I often ask guests is, how do you view change? What does it take for someone to change? How do people change?
I think the first step is really educating yourself, being your own patient advocate when something doesn't feel right, to try and seek answers and start exploring. And that is, I have a dental background. So my background is in dental hygiene, over 18 years in the dental industry. And consequently, we are the gatekeepers to the airway. So it makes sense that our dental providers become educated to start screening for that. So hopefully, in our line of work, we can help reach a lot of different people outside of traditional medical, and even in your line of work, help to start screening people. So I think education is the biggest one. Yeah,
and I love what you're saying there about taking your health into your own hands. I know for me, I've had a number of experiences where if I wouldn't have, I wouldn't have gotten better in different areas. And I think, in my clinical practice too, and I talk with a lot of therapists, that's what we're really trying to support people in doing, right? Stepping out of this position that I think a lot of people view like the Western medical doctor. You just go to them, they're going to fix your problems, right? But really empowering people to make change themselves and that lasting change. And I think there's so many different spheres that's important. Mental health, but also with physical health. Curious if you could explain a bit. So you're a dentist and you're also a myofunctional therapist. I know when you started talking to me about myofunctional therapy, I had no idea what it was. So maybe you could
Yeah.
share what is myofunctional therapy.
So it's funny because I practice independently. I'm an independent dental hygienist, and a lot of people refer to me as a dentist, which is really sweet. I really appreciate that. But I am a dental hygienist. I work independently, and I've also taken extra training for myofunctional therapy, which is repatterning of the oral facial muscles. So, in essence, it's like physical therapy for the mouth. The main goals are nasal breathing, lip seal, tongue up in the palate, and proper swallow. So those are the things that I'm looking for as a myofunctional therapist. And with all of those elements coming together perfectly, you have a greater chance for overall health and wellness.
How did you get into myofunctional therapy? Could you tell me that
I know,
story?
seems kind of odd, right? Well, I was introduced to it by a dentist who was doing Airway training several years ago. And it really just put the pieces of dentistry together for me, things that were never answered. And I'll give an example. In dentistry, quite often when we see a patient who maybe they clench or grind their teeth, we give them a night guard. And yes, the night guard protects their teeth, but it doesn't solve the root cause or the underlying issue. And so when I started becoming educated about airway and myofunctional therapy and discovering that there is, in fact, a root cause, that was it, right? Especially for somebody like me who really values overall health. We don't just look at just the mouth, we look at the whole person. The mouth is connected to the rest of the body. So, on top of that, I have a son who struggled with being sleep deprived, but his pediatrician sent us to a number of different specialists to try and get answers, and nothing really worked until I received the training and I realized that he does not have ADD. He does not have sensory processing disorder. He was, in fact, sleep deprived.
Wow.
So, as a mom of a child where you have been able to seek out these underlying root causes, that was it. I was down the rabbit hole.
Wow.
Yeah.
That's beautiful. And have his sleep issues resolved then, having cleared up the breathing?
I wouldn't say 100% because he's still a work in progress. We had his tonsils and adenoids removed, which were touching. I had been to the ear, nose, and throat doctor a few times saying, my son, he's snoring every night. He's wetting the bed past potty training age, 6, 7, 8 years old, still wetting the bed every night. So now we've gotten into some expansion to help widen the upper jaw and give him more of a patent airway space. So he's still a work in progress, but his symptoms have improved drastically. So myofunctional therapy will play a role in his course of treatment, but once you are a mom or a parent and you see your child affected, it's game over.
Yeah, right. You're gonna figure out what can be done. Absolutely. And will you speak a bit? I'd like to talk a bit about. So a lot of our listeners are therapists. A lot of listeners interested in therapy or practitioners of some sort. And if someone a client is presenting with sleep issues. Or maybe they're not presenting with sleep issues, but what are like the common symptoms to look out for when someone is having problems with sleep?
So in order to understand the symptoms, I'll take you back a little bit. So Looking back even at the work of Weston Price, we talked about that
Yeah.
before, and he did research into cultures that were isolated, and he found that they didn't have dental crowding, that they had closed lip posture, they were nasal breathing, they were almost immune to tuberculosis and other diseases. And he found that it was because they were not westernized in their culture. They did not have processed foods. They did a lot of chewing. They chewed hard root vegetables. They nursed their children, 3, 4, 5 years old. And all of that is helping to develop the palate,
Yeah.
to develop proper arch development, proper airway. So with our westernized culture, we have grown backwards. Our skulls are shrinking. We have dental crowding. And because of that, we're also pinching off our airway. So when I see patients in the dental chair, there's a big opportunity to be able to see things present themselves in the mouth that connect itself to the rest of the body. So when I look in somebody's mouth, I'm looking for crowding. That's indicative of a small jaw or small airway. I'm looking at their palate. How high vaulted is it? Does their tongue rest up there? Because the palate is the floor of the nasal cavity. So you're losing a lot of nasal volume if the palate is narrow or highly vaulted. I'm looking at nasal breathing. I'm looking at erosion. I'm looking at all of these signs of a small airway, including clenching and grinding. That can be a risk factor. And then you just start the dialogue with your patient. Are you sleeping okay at night? Are you snoring? Do you wake up and you feel rested? Interestingly enough, the statistics for sleep apnea used to be overweight males over 50, but we're seeing this epidemic of young, thin females who are presenting like they've had sleep apnea for 50 years. Wow. And they're exhausted and they have anxiety issues. But the reason is because they have a small mouth. They have underdeveloped mouth. So it's been an interesting journey, taking what you've learned and applying that to your practice and your patients. And what I'm seeing in clinical practice is astounding.
Yeah. So I'm hearing generally in the past, older men would be predominantly the ones who'd present with sleep apnea, but now there's younger people, and specifically younger women, who have just a smaller mouth and trouble breathing because of that? Or?
So let's put this into perspective here. So we have dental crowding, and our instinct in the dental profession is to maybe take out teeth. We kind of bring everything back when we're pinching off the airway. If at night that particular person goes to sleep, their tongue falls back in the airway space, what essentially they're doing is they're depriving themselves of oxygen at night. Sleep apnea is where you lose oxygen for, let's say, 10 seconds or more. But what happens to the patient who's stopping breathing for 5 seconds or 8 seconds at a time? They're not considered full-blown sleep apnea, but they're still having respiratory disturbances. And that is equivalent to slamming on the brakes to avoid hitting a deer in the road, or they're activating their sympathetic nervous system, their fight or flight. And that happens multiple times a night, every single night. So then they have this constant sympathetic tone. They're constantly in fight or flight, and they don't ever reach a baseline. Their baseline is constantly elevated. So anxiety is actually really strongly correlated with a narrowed airway because of that path that we just talked about.
Yeah. So if I'm a therapist and I'm treating someone with anxiety and, it just seems like I'm not getting in anywhere, this may be something to definitely have on my awareness of, are they tired? Are they exhausted? Is their partner, spouse, parent, whoever lives with them, noticing their snoring, noticing their not breathing for periods of time? It may be indicated to refer to a dentist or a myofunctional therapist.
Right. So I can give you specific things to look for. And I'm not saying everybody has sleep apnea, although I think it is worth looking into sleep to rule it out. If a patient reports that they're clenching and grinding, if they snore at night, if they're not feeling rested, if they have trouble going to sleep, staying asleep, if they get up in the middle of the night to go to the bathroom multiple times. A lot of people think they don't sleep well because they have to get up and go to the bathroom a lot. But what's happening is your body is not releasing the proper hormones and getting into the proper stages of sleep. So the body will draw oxygen where it needs, and they will then have to get up and go to the bathroom multiple times at night. So in kids, they actually eliminate. They don't have that cue to wake up, so the body will do it for them. So those are really big signs. In children, there are studies that were done where the symptoms for ADD are identical to the symptoms for sleep disordered breathing. So it's no surprise that we may be over-medicating and over-diagnosing when it could be a child that's just sleep deprived.
Sure.
So, like I said, not saying that every child with ADD has sleep disordered breathing, but it would behoove us to cross that off as a factor first, maybe before prescribing a medication.
Yeah, absolutely. And if your client or maybe your child or friend, loved one who you are noticing, has ADHD symptoms, has anxiety, maybe snores, or is the best place to refer them to a myofunctional therapist first? Go to a sleep clinic. What's the best first step?
There is a large community of Airway providers, so I would encourage somebody to look through those Airway provider portals because there's a big network of people. Airway Circle is a great one, the Breathe Institute. There's a lot of directories out there that can help you find an Airway provider in your area. A sleep physician. Not all pediatricians are trained in airway education. Not all dentists are, but certainly myofunctional therapists have that training. And so I think that going forward in our profession, that's what we're looking to do, is to really get this collaboration of providers, pediatricians, and dentists and therapists, and everyone to be looking at the person as a whole and not compartmentalize their treatment.
Yeah, absolutely. So I haven't read James Nestor's book Breath yet. I want to. I'm going to
Yes.
sometime soon. But I've listened to a few of his podcasts, and he seems like one of the leading figures in this world of pulling together research and conveying it to the public around the importance of breath, importance of nasal breathing in particular. When I first heard that, I was just like, nasal breathing? Is that important?
Yeah.
Could you share a bit about why nasal breathing is so important for people?
So James Nestor, who wrote the book Breath, it's a fabulous book. I highly recommend it for anyone. Interestingly enough, he is a journalist, so he wasn't a medical professional at the time. Although he is very medical savvy, he did an experiment with a colleague where they actually blocked their noses and were forced to breathe through their mouth for 10 days. And he journals all of that in addition to all of the extensive research that he had done. But it really highlighted the importance of overall health and wellness and nasal breathing. So when we breathe through our nose, it warms, filters, and humidifies the air. So for an immunology standpoint, it helps to filter out, which is why during COVID, the controversy of mask wearing, we weren't really filtering and breathing through our nose properly. So that was, I know that's kind of a buzzword topic, but there was a buzz in the myofunctional therapy community about that because we know of the detriments of mouth breathing. Not only when you mouth breathe, you change the shape of the way your jaw grows. So the tongue resting in the palate helps to shape the jaw. We produce nitric oxide when we breathe through our nose, which helps to dilate the blood vessels, carry oxygen to the rest of our body. But one thing I did want to point out is that when we nasal breathe, our tongue should live and rest up in the palate, which actually stimulates our vagal tone, our vagus nerve response. It stimulates the rest and digest.
Yeah.
And so if it's not living there, we are living in a more sympathetic tone. We're living more in our fight or flight.
Yeah.
So it's all connected.
Yeah, that was news to me when you told me that. And since you told me that, I have been putting my tongue up in the palate, and I'll let the listeners know I was very awkward at first. I was like, really? You're supposed to put it up there? Because it always lived. But when I started to, it's now just become habit for me.
Right.
And I do have that experience of being very regulating. You know, I think when we as therapists are inviting clients to do square breathing, diaphragmatic breathing, so helpful. And in addition to that, you know, if it's not too overwhelming for that person, to introduce that concept of putting the tongue on the roof of the mouth, because there's research that shows it's stimulating that parasympathetic vagus relax, you know.
Yeah.
And that's we need. I think we all need that in our society, such a fast-paced society.
It is a way, if you're having anxiety, to start to calm and bring things back down to center, right? Mm-hmm. You start taking deep breaths in through your nose for 5. You hold for 5 and then exhale for 5, all with your tongue resting up in the palate. And even James Nestor in his book described how he gathered all of these hymns and prayers from different cultures. And amazingly, they were all to the tune of 5 seconds in, hold for 5, 5 seconds out. So those hymns and prayers were working to get into your deeper conscience and working to get you in your relaxed state, you know, things that our ancestors knew hundreds, thousands of years ago that we're having to kind of come back to and relearn.
Yeah. That's a question I kind of had. I don't know if you'll have the answer, but, you know, if this is something that the human body, it's adapted for the human body to do, and humans have been doing it for seemingly, like, based off Weston A. Price's research. And when you look at like modern hunter-gatherers, they are doing nasal breathing. How, like, why did I, or, you know, why are there so many people in modern society who are mouth breathing? And you talked about food, or...
Well, it's not, so it takes so many thousands of years for a genetic mutation to express itself in half of the population. So this phenomenon of mouth breathing only happened over a couple hundred years ago, right at the start of industrialized culture, right when we started processing and cooking our food. So that's part of it.
Yeah.
Our food is part of it.
Because the part of that is the chewing, right? We don't chew as much.
Right.
I think James Nestor is saying we historically would be chewing for like 4 hours a day.
Right.
And
At
I know I don't do that.
Yeah. It can also occur due to allergens. So we have a lot more allergens and toxins in our environment, molds. That's a big one, which can force us to breathe through our mouth if we become stuffy. And then as soon as you start to breathe through your mouth, the body's response is to produce more phlegm. And so more phlegm means you're going to breathe through your mouth even more. And then your tongue has to lay low for that to happen. So that becomes a cycle. Children who are born early, who are born premature, will often have trouble with the tongue up in the palate because they have a physical tether of that frenum or that band of tissue under the tongue that's too tight, pulling it down and not letting the tongue function properly, living up in the palate. So I know we did talk about resting the tongue up there, but it's important that the full tongue can actually make contact. So not just the tip, but also the middle and back, because we want to create that seal. We want our air to come through the nose, down to the lungs, not out through the mouth.
And so let's say someone listening to this wants to give this a try. Put your tongue, the roof of your mouth, not touching your teeth, you were saying, right?
So there's a little bump of tissue behind the front teeth on the top. It's called the incisive papilla. That's where the tip of the tongue should rest. Middle and back up in the palate, gently suctioned. Lips together, teeth slightly apart.
I think I got it, but
Yeah.
but I couldn't, when you first explained it to me, I could not do it. And it's taken like a few weeks for me to actually make it a habit. So,
And that's what myofunctional therapists do. So we train you how to make it a habit during the day through repetitive exercise, because when it is a habit, then you are more likely to retrain that neuromuscular connection and have it become a habit at night.
yeah.
Which is interesting when I see little ones come in, or even adults who may have sucked their thumb or have another oral fixation like fingernail chewing. Some people will bite on the ends of pencils or pens, but a lot of those people don't have proper tongue posture. They're not resting it up on the spot, we call it, that bump behind the front teeth. Because it's soothing. It releases those dopamine, serotonin, things. So when a child doesn't have proper tongue posture, they stick their thumb there to replace that, because that's releasing the feel-good sensations.
Oh, interesting.
So they'll seek that. So it'll be really tough to break a child of that habit, or an adult. I mean, there are adults that still suck their thumb. They're looking for that.
The soothing.
Yes.
It's soothing. Yeah.
Yes.
Interesting.
So it would be hard to break that habit unless we got proper tongue position.
Gotcha. Well, let me see. I wrote down some notes. I want to make sure we're touching on everything. So you said anxiety, ADHD, in terms of like the mental health symptoms that someone would generally experience who maybe has sleep apnea, full diagnosable sleep apnea, or maybe has sleep apnea like symptoms but wouldn't fully meet the criteria. Are those primarily what we would look out for, is like ADHD, anxiety that's just, seems to be treatment resistant with psychotherapy? Right.
So any type of snoring is a form of apnea on the spectrum somewhere. You're essentially nighttime choking. And not only does it create psychological effects, but you're looking at all of those inflammatory diseases that are affected by oxygen, cardiovascular diseases. 90% of stroke victims have sleep apnea. So anxiety and depression are just one aspect, but I do want to point out that there is something called upper airway resistance syndrome, and it's basically the precursor to sleep apnea. It's basically saying you are losing oxygen at night, for X amount of seconds per episode, but you haven't quite reached the full-blown sleep apnea section. But people with upper airway resistance syndrome exhibit the same symptoms, but they haven't quite reached that end of the spectrum. So if I were a therapist, I would actually include some of these questions on my intake, or these questions when I'm interviewing a client. How is your sleep? Do you stay asleep for the most part at night? Do you snore, or have you had a bed partner or somebody that lives in your home say that you snore? Do you clench or grind your teeth? Tonsils and adenoids, which I know we don't traditionally look in people's mouths, right? But
Yeah.
people can tell you, like, yes, I've had huge tonsils my whole life, and because of it, I have to breathe with my mouth open. Even looking at mouth posture, are they somebody that has trouble breathing through their nose, which we know gives them the vagal response and the rest and digest? So just a few of those observations or questions, you'd be surprised how many people present with those.
Yeah, that's really helpful.
Yeah.
And yeah, when you were talking about snoring, it made me think of the podcast I recently listened to with James Nestor, and he was
Right.
talking about culturally, it's like, oh, it's so cute they're snoring,
Right.
right? It's like almost a comedic thing when a kid or
Right.
adult snores, but it's actually like a major health concern.
It is. We always use the term, it may be common, but that doesn't mean it's normal.
Yeah.
So,
yeah.
Yeah.
And there's so much in our society, I think, that is common that's not necessarily helpful for
Right.
humans' physical and mental well-being. I'd be curious to pick your brain a little bit more on Weston A. Price's work. He's someone who's really intrigued me. I think that there's so much we can learn from modern modern day hunter-gatherers, as well as, like listening to anthropologists and their study of traditional cultures and, food. My wife's a nutritionist. She's been on the podcast, and I highly recommend people listen to those episodes and really take, like we were talking about earlier, taking your health into your own hands, because, food's a huge piece of this health puzzle as well, both mental and physical health. But curious if you could speak a bit more to Dr. Price's work, and I'm hearing his findings were that there was nasal breathing. What else did he find when he was visiting those groups?
He found, and I'm not incredibly familiar, but kind of on the outskirts of his work, he really found that in these isolated cultures, he found they had room for all of their teeth. They had these beautiful developed jaws, broad, wide, down forward growth, nasal breathing. And even in some Native American cultures, he would observe that when the mothers would lay their babies down, they would gently close their lips together and encourage nasal breathing.
Wow.
So they knew that in order to be healthy overall, that nasal breathing was an important component. So, with our society now, trying to get back into the way that our bodies were designed to work, nutrition is incredibly huge. And Natalie is amazing. She is truly amazing, and she is incredibly knowledgeable. And I actually have patients that I work with that I refer to a nutritionist.
Oh, nice.
Because it's not just about getting your tongue up there, but, what kind of diet do you have? Are you eating the proper balance of nutrition in terms of protein? What's your sugar intake like? That can really have an effect on your overall health and anxiety and hormone balance. And, I really feel blessed with the work that I get to do, because I'm not just a spit sucker dental hygienist, right?
Uh-huh.
I don't just suck spit, contrary to popular belief. But really getting back to if you have a patient that's having trouble with decay, what's their diet like? What are they eating? Are they sipping on a beverage that may be a little too acidic throughout the day? So nutrition really plays a role in everything we do.
Absolutely. And, as an N of one example,
Right.
I had a lot of dental issues growing up, number of root canals, number of crowns and fillings. And I ate the standard American diet, the SAD diet. And, I started about 5 years ago really shifting away from processed foods and sugar, and I don't eat any processed foods or sugar anymore. And like I've not had since doing that, I've not had any dental issues. So it's amazing how the bacteria that lives in our mouths and saliva is impacted so much by those foods, and is a big part of tooth decay and dental problems, which it's just all connected too, right? Because that's then affects our mental health and physical health as well, as I understand it.
I'm glad you said that, because they're finding now that when you sleep with your mouth open, that you're changing the oral bacteria, the homeostasis of your oral flora in your mouth, and it can actually be more detrimental than the diet that you eat. Even though Weston
Wow.
Price, when he did his research, found that they really didn't have dental decay in these isolated cultures. So that is playing a factor into decay, but also mouth breathing. It's changing things in your mouth, the way that your oral bacteria should function.
Oh, interesting.
Yeah.
Are there any other recommendations that you'd make to someone who's listening that's like, "Oh, this is new information to me. I maybe personally, or for certain clients, I definitely think this could be helpful for them." Is there anything else that you'd want to mention in terms of what someone can do other than, focusing on that nasal breathing, having the tongue up on the roof of the mouth?
I would really seek those hubs of airway professionals, Airway Circle, the Breathe Institute, AAPMD. There are organizations across the globe, so it's not just a United States organization. There are providers that are collaborating worldwide to get these studies together, and there is a ton of information out there. So if you were to Google myofunctional therapy or airway concern or tongue tie concern, that would be something that I would do first. Secondly, I would be your own patient advocate, right? So if you're not getting the answers that you need, finding your myofunctional therapists, finding the dental providers that are airway savvy. Not all disciplines are trained yet, but hopefully that is on the move. I have one short story about a patient that maybe one of your listeners might relate to.
Oh, that'd be great.
I was working in a private practice 2 years ago, and I had this patient in the chair. He was a male. He wasn't overweight by any means. He was in his 40s, and I noticed some erosion on his teeth. So they were worn, but in a manner that was indicative of acid erosion. And I kind of looked at him and I said, "Do you happen to have trouble with reflux?" And he kind of turned and looked at me, and he's surprised, and he says, "Well, yes." And I said, "I'm seeing some signs in your mouth of, possible sleep trouble. Do you snore at night? How is your sleep?" And he immediately started to well up with tears. And I sit him up in the chair, and he said, "I can't tell you how many doctors I've been to for my reflux, and nobody can seem to find a solution. I'm on medication." And I said, "I don't think that your tongue is resting properly, and that Therefore, I don't think you're swallowing properly. I think you're swallowing in too much air and it's sitting on top of your food in your stomach and trying to come up. And he says, no, you don't understand. I've had to quit my job. I had to start sleeping in another room separate from my wife. I was so tired I couldn't stay awake and nobody could tell me what was wrong. My wife and I have since separated and it's totally affected his whole entire life. Obviously, I got emotional because here I am, the dental hygienist that's cleaning his teeth, but yet I'm unraveling part of his story that's impacted his whole life. And I haven't seen that patient since, and I don't know where his story led him, but I do know that I was able to kind of set him on a path that maybe these symptoms had a root cause.
Yeah.
And so I would say that if you have things that you're experiencing that you're not finding a solution for, there is a chance that they may be connected because our body is connected. Everything is.
Yeah, absolutely. And yeah, how powerful it can be to get an answer. I know I personally had chronic stomach aches growing up and went to, the general practitioner, went to a gastroenterologist, and he was, did a number of tests and said, we can't diagnose you with anything. We can't say there's anything wrong. But it was like the worst pain I've dealt with in my life. And I have like a somewhat high tolerance for pain. And another thing with nutrition for me is those stomach issues have completely gone away since I've really shifted how I eat. But if I just got lucky that I married a nutritionist,
Right.
if I would have just stuck with that knowledge and not had that understanding of like there's something deeper going on here that I can work out, I would have just had to live with all of that pain for the rest of my life. So what a wonderful story, and bringing to someone's awareness a potential cause of that, the sleep problems and the snoring, and the acid reflux.
I see people like that every day, stories like that every day. And I'm not saying that they all have sleep apnea, but I can definitely tell you that they do have some oral myofunctional disorders, and maybe they are connected, but these are things that nobody has recognized before. And I'm able to connect them with the right people and start to unravel this. And, just as simple as patients that I see well into their 70s and 80s that maybe are on a CPAP and they're struggling with compliance, but their tongue isn't resting up. They're not getting the air where it needs to go. And I was treating this wonderful patient in her mid-70s, and she had her tongue tie released because it was tethering too far down. And she started crying because she was able to roll her R's for the first time, and her husband is Hispanic.
Wow.
And it was really important to her.
Yeah.
And it's not something that we planned on or that we talked about happening, but it happened because of all of the other things that we did. So
wow.
It's very gratifying work, and definitely on a mission to educate, everyone as much as I can.
Yeah. Well, I wish we had more time to talk.
I know.
We're about the end of the hour
Yeah.
here, because I'd love to hear more stories about the changes in people's lives with the myofunctional treatment. But the question before I ask the last question, if people are intrigued by this work, you gave a few resources. I'll link in the show notes. How would people get in contact with you? How would they learn more about your work if they're interested in reaching out?
So my website is definitely a great place, compassionatedentalwellness.com. I have some great resources on my page. The cool thing about being a dental hygienist before I became a myofunctional therapist is that I have a research background. We're always looking for the research and the studies. So everything that I've talked about today, there's some great resources on my website, studies, meta-analysis, clinical research. And if there's something that one of your listeners has questions about, I actually have a personal library of research. So if there's something they're wanting to dig a little more into, shoot me a message through my website and let me know. Or my email is manager@compassionatedw.com. So those are two great ways.
Perfect. And I'll link all that in the show notes as
Perfect.
well. The last question I like to ask guests is, what's a message of hope you'd like to leave people with?
Ooh, that's a big one. A message of hope. I would maybe say that no matter what you're going through, that there is always somebody there to help guide your path, whether it be a therapist, a myofunctional therapist. So don't ever stop searching and don't ever take no for an answer. You're your own best advocate. So.
Oh, I love that. And leads to continuing to move towards connection, because I think that there's a lot that gets in the way of connection with ourselves, with those around us, and finding people that can support us in deepening that connection with others and helping us in various areas is indeed hopeful to me. So,
Right. Agreed.
Yeah. Great. Well, thanks so much for being on the podcast, Tommie.
Thank you. I appreciate it.
Please press the subscribe button, as well as rating and reviewing our podcast. This helps others connect with what you've been hearing. If you have any questions, please contact us at themindofatherapist@gmail.com. These questions will be kept anonymous. I want to thank Eric Price for the wonderful music you hear in this podcast. Additionally, this podcast was created to provide accurate and authoritative information on the subject matter. Although we are interviewing licensed therapists, they are not your therapists. This podcast is not intended to serve as direct medical advice and should not be used as a substitute for direct professional help. It is given with understanding that neither the host, publisher, guests, or PCS are rendering legal, clinical, or other professional information. If you need a professional, we encourage you to find one. Visit Psychology Today to connect with a licensed clinician near you.